So here is my research study from last year. That is the diastasisrecti abdominal research that we did. This is efficacy of a curl-up task for diastasisrecti abdominis. We are presenting this at the APTA CSM 2024 in Boston. And this was done with the University of Dayton and my clinic. So what we were looking at is we were trying to determine if a focused 12 or 24 week exercise program would help improve the strength of the rectus abdominis and decrease interrecti distance and improve abdominal strength in women who have given birth. Now, I would like to say the neat thing about our study, these women are not immediately postpartum. Oftentimes when you see DRA studies, these women are immediately postpartum and there is spontaneous healing that happens. These are women that are usually not seen in research. These are the women that are just like you and I who have split abs and abdominal weakness. And how old are your kids? We're not going to talk about that. But these are real strength gains we're about to see. So our methods of measurement, we used calipers that you will see here to measure the interrecti distance, the space between the two rectus abdominis six-pack muscles. And I also monitored it with my fingers. So if you have a 2-finger separation, that means you are positive for diastasis recti. And I checked patients at the belly button 2 inches above, 2 inches below. But for the sake of crunching numbers, we only crunched the numbers at the level of the belly button. We tested the people with rest and saw the gap at rest and with active contraction, so with a curl up. Then we also did manual muscle testing for the abdominal strength, so asking them to do a sit up, and everybody failed. Our study was 2 groups of intervention and 1 group of control. Group A did intervention for 6 months. Group B did intervention for 3 months, then stopped. And then the control did their just normal basic everyday life. In the exercise that we asked people to do, we asked them to do a curl up task. So a modified tiny sit up, and we had them do a pre-activation of the transversus abdominis, and we instructed them to do 5 reps, holding 5 seconds, and we asked them to do it 3 times a week. What we talked about with our patients with this diastasis recti was prioritizing the exercise into their life, making sure they understood breathing mechanics and could they breathe. Of course they can breathe, but what I mean is, did they know how to exhale properly and drop the lower ribs? This education on lower rib mechanics was one of the most significant things women told me that made a difference with helping their abs. So we asked them to take a breath in, blow out. As you are blowing out, you are exhaling and your ribs are dropping down. We helped people figure out how to bolster down their ribs. Then we also talked about posture education, not hanging out on one hip and stacking yourself nicely. Not hanging out one side versus the other is a nice way to not irritate your abs. We are looking for symmetry and helping people learn about proper posture. Our subjects were all similar in age, BMI, and the number of pregnancies. The average time since delivery was a little bit longer for the control groups. It was 69 months compared to 43 months. But I want to tell you something. What's awesome about this is it's to say no matter how far postpartum you are, you can heal your abs. So the results that we found for their interrecti distance, all groups did have an improvement of their interrecti distance. So there was an improvement in everybody's gap, but the intervention groups, A and B, had a significantly greater decrease in their gap because they were working the rectus abdominis than the control group. So we know we saw a statistically significant change. The abdominal MMT, the abdominal strength, was significantly greater in both intervention groups compared to the control group. Meaningful strength changes may require a longer intervention greater than 24 weeks than the 12 weeks, which this makes sense since the way we would close the gap would be to strengthen the rectus abdominis. And the rectus abdominis is the thickest muscle of the abdomen, and the more time we have to have hypertrophy and muscle gains, the better it will be. So this program challenges what traditional diastasis recti healing is by us incorporating a curl up task by actually firing the rectus abdominis. We emphasize the linea alba tension in maintaining that tension in the linea alba and the TA activation. Our data demonstrates the importance of a long-term, simple home exercise program for reducing IRD, the distance between the abs, and improving strength. Physical therapists can absolutely optimize outcomes for women who have given birth by incorporating a diastasis recti program that includes the curl up task with TA activation with a 12 to 24 week program. It is never too late to start to heal your abs. And also, please know that if you want to heal your abs and make your abs stronger, you're going to have to do a curl up because pelvic floor and TA will not heal the rectus. And the only way to heal the rectus is to use the rectus abdominis, the six-pack muscle. So, doing a little sit-up action isn't so bad.